Hi, in this video we will try to define the prognosis of treating urticaria hives using homeopathic medicines. Urticaria is a very common problem which almost 20% of the world population sometime or the other would suffer with. But today we will focus more on chronic and recurring urticaria rather than just acute urticaria which might go in a couple of hours or maybe go away in a couple of days. My name is Dr. Rajesh Shah. I am a medically trained homeopath and I head Life Force Homeopathy, where we treat patients of urticaria and many other chronic diseases from across the world for the last 3.5 decades. Urticaria is a immunologically mediated disorder which is essentially not restricted to only allergies as it goes. So what I mean by that is that it is not necessary that every case of urticaria will have some known allergens or some factors from outside food which will induce urticaria. One can have urticaria because of external factors or allergens as well as internal factors from inside, from within, and that may remain unknown to us in many cases. We have treated and documented over 4,000 cases of urticaria, and we have some understanding about this disease. Though it might look very simple to treat, but sometimes chronic urticaria could give a real difficulty in its treatment, because many patients who come to us, they are taking antihistamines or some anti-allergic medicines for a very long time. Sometimes they might be taking medicine for 6 months to maybe even 10 years, and these medicines become a part of their lives, and then it becomes very difficult to really reduce them and de-addict them, as I call it at times. So depending on the cause of urticaria, as I said, internal or external factors, most cases they do very well with homeopathy. I'm talking about chronic cases. Some cases might be difficult, especially those who are heavily drug dependent, including immunosuppressants or even simple antihistamine medicines. But if taken for a very long time, that could pose a difficulty in de-addicting the patients. The factors include immunological factors, hormonal factors, genetic factors, external allergic factors, stress factors, lifestyle, and so on. So many times we do not know what causes urticaria. There are also a couple of variants of chronic urticaria which we must mention, that is Urticaria pigmentosa, which is often seen in children also, where it leaves behind severe hyperpigmentation on the skin, and also urticarial vasculitis, which is a disease of small blood vessels beneath the skin, and they get inflamed, leading to urticarial rash, which is one of the difficult variants of urticaria in our experience. Does homeopathy help cases of urticaria? Yes, it does. Homeopathy plays a big role in the treatment of urticaria, and it is very strongly recommended in most of the cases. In my humble experience, around 20% of the patients might be very difficult to treat, but around 80% of the patients in general are likely to respond extremely well to well-selected homeopathic medicines. How much time does it take to treat urticaria? Well, it depends on several factors such as the cause of urticaria as well as the duration of urticaria. If the patient is having urticaria for last say 2 to 4 months, then he or she may recover within maybe a couple of months' time. If somebody is having urticaria on the other side for 10 years or 15 years, then it may take maybe more than 2 years of treatment, because the treatment also will entail reducing the dependency on other medicines slowly and strategically. I hope this video helps the general public as well as the medical practitioners and the students. Thank you.